7 early signs. Your body isn't handling sugar well. Most people think sugar problems start when a doctor finally says you have diabetes. But that is not usually how it begins. Long before diabetes shows up clearly on a lab report, your body may already be struggling to handle sugar smoothly. The blood sugar may still look almost normal. The fasting number may not scare anyone yet. You may not feel sick. You may still be walking around working, eating, sleeping and telling yourself I'm fine. But inside the body, something important may be changing. Your cells may not be responding to insulin as well as they used to. Your pancreas may be forced to make more insulin just to keep your blood sugar in range. Your liver may be releasing more sugar than your body needs. Your muscles may not be storing glucose as well because muscle mass has declined. And after 50 or 60, all of this can happen quietly. This is where people get fooled. They think sugar trouble means dramatic symptoms, extreme thirst, constant urination, weight loss or feeling very sick. Those can happen when blood sugar is high enough. Mayo Clinic lists symptoms such as increased thirst, frequent urination, tiredness, blurry vision, slow healing sores, frequent infections, and numbness or tingling in the hands or feet as possible diabetes symptoms. But type 2 diabetes can also develop slowly and go unnoticed for years. But early sugar problems are often quieter than that. They may show up as sleepiness after meals, cravings, belly weight, brain fog, blurry vision that comes and goes, slow healing, tingling feet, waking up at night to urinate, a feeling that your energy rises and crashes instead of staying steady. Now I want to be very clear. These signs do not prove diabetes. They do not mean your body is failing, but they can be early clues that your blood sugar system is under pressure. And the earlier you listen, the more chance you have to protect your energy, your nerves, your heart, your kidneys, your eyes, and your future health. The first early sign is getting unusually sleepy or foggy after meals. A little relaxation after eating is normal. But if you feel like you need to lie down after lunch, if your eyes get heavy after bread, rice, pasta, potatoes, cereal, dessert, or sweet drinks, that is worth paying attention to. Most people say, I'm just tired, or I ate too much. And sometimes that is true. But if this pattern happens often, especially after higher carbohydrate meals, your body may be struggling to process glucose smoothly. Here is what may be happening. When you eat carbohydrates, your body breaks them down into glucose. Glucose enters the bloodstream. Then insulin helps move that glucose out of the blood and into the cells, especially muscle cells. But when your cells become resistant to insulin, the pancreas has to release more insulin to get the same job done. That extra effort can create unstable energy, a rise then a crash. This is where it gets interesting. Your fasting blood sugar may still look normal, because your pancreas is working overtime to keep it there. But after meals, the system may be under stress. You feel it as heaviness, sleepiness, foggy thinking, or a sudden loss of motivation. Most people miss this because they only think about blood sugar in the morning. But your body lives through meals all day. Breakfast, lunch, dinner, snacks, coffee, drinks, juice, desserts. Every one of these is a test of how well your body handles sugar. A better meal pattern is not about fearing carbohydrates. It is about slowing them down. Add protein. Choose slower carbs more often, like beans, lentils, vegetables, oats, berries, or whole grains, if they fit your body. And if you can, take a short walk after meals. Even 10 minutes can help your muscles use glucose more effectively. The second early sign is craving sugar or starch soon after eating. This one can feel embarrassing. You just ate, but an hour later you want cookies, or bread, or chips, or cereal, or something sweet with coffee. You tell yourself, I have no discipline. But this is where people get fooled. Cravings are not always a personality problem. Sometimes they are a blood sugar rhythm problem. If a meal is high in refined carbohydrates and low in protein, fiber, and real nutrition, blood sugar can rise quickly. Then insulin responds. In some people, the blood sugar may fall faster than expected, and the brain starts asking for quick fuel again. That can feel like hunger, irritability, shakiness, anxiety, or an intense craving for something sweet. And after 50, this can become more common because muscle mass often declines. Muscle is one of the biggest places your body stores glucose after meals. Less muscle means less storage space. When there is less storage space, the pancreas and liver have to work harder. This is why crash dieting can backfire. If you lose muscle while trying to lose weight, you may make sugar handling worse over time. The goal is not just a lower number on the scale. The goal is a body that can use glucose well. So if you are hungry 1 hour after eating, look at the meal. Was it mostly toast, cereal, rice, pasta, crackers, sweet yogurt, pastry, or a sandwich on refined bread? Did it have enough protein? Did it have vegetables or fiber? Did you drink calories with it? Most people do not need more willpower. They need meals that do not create a glucose roller coaster. The third early sign is belly fat, that keeps growing even if your weight has not changed much. This is one of the most important signs after 50. You may step on the scale and think, I haven't gained that much, but your waist tells a different story. Pants feel tighter around the middle. The belly feels more stubborn. You may notice more fat around the abdomen, while your arms and legs feel softer or weaker. This matters because belly fat is not just stored energy, it is metabolically active. It can release inflammatory signals and fatty acids that interfere with insulin function. The more insulin resistant the body becomes, the harder the pancreas has to work. This is where people get fooled. They treat belly fat like only a cosmetic issue. But belly fat can be a sign of deeper metabolic stress. NADDK explains that insulin resistance happens when cells do not respond well to insulin. So the pancreas makes more insulin to help glucose enter cells. Over time, blood glucose can rise into prediabetes or type 2 diabetes if the pancreas cannot keep up. That is the hidden story behind many growing waistlines. The body may be making more insulin than before. Higher insulin can make fat storage easier, especially around the belly. Belly fat can worsen insulin resistance. Then insulin resistance pushes the pancreas harder. It becomes a cycle. The way to interrupt that cycle is not starvation. It is smarter consistency, strength training to protect muscle, walking after meals, better sleep, fewer sweet drinks, more protein and fiber, less ultra-processed food, better stress control, and knowing your numbers, because guessing is not a strategy. The fourth early sign is thirst, dry mouth or waking up to urinate more often. This is one of the more classic blood sugar clues, but early on it can be subtle. You may notice you keep water near the bed, your mouth feels dry in the morning, you wake up once or twice to urinate and tell yourself it is just age. You feel thirstier after dinner. You may blame salty food, dry air, or getting older. And yes, those things can play a role. But blood sugar should also be considered. When blood sugar rises high enough, the kidneys try to remove extra glucose through urine. Water follows that glucose, which can lead to more urination and more thirst. Mayo Clinic describes increased thirst and urination as common diabetes symptoms, because extra sugar in the blood causes fluid to be pulled from tissues and removed through urine. Now, this does not mean every bathroom trip is diabetes. Nighttime urination can come from enlarged prostate, bladder issues, sleep apnea, evening fluids, caffeine, alcohol, water pills, kidney problems, or heart issues. Dry mouth can come from medications or mouth breathing. But if thirst, dry mouth, and more urination come together with fatigue, cravings, belly weight, blurry vision, or slow healing, do not ignore the pattern. Most people miss this because the change happens gradually. They do not suddenly go from normal to severe thirst. They just start drinking more. They wake up more. They keep water nearby. They adapt to the symptom instead of asking what it means. And this is why that matters more after 50. Your body may have been compensating for years. By the time the symptom feels obvious, the metabolic stress may already be well established. The fifth early sign is blurry vision that comes and goes. This one scares people, and understandably so. Vision matters, but blood sugar-related vision changes do not always feel dramatic at first. You may notice that reading looks a little blurry after meals. Your vision may seem different in the morning than later in the day. You may feel like your glasses prescription keeps changing. Some days your eyes feel fine and other days they feel tired, strained, or unfocused. This can happen because changes in blood sugar can affect fluid levels in the eye, including the lens, which can temporarily change focusing ability. It does not always mean permanent damage, but it is a clue that glucose may not be stable. This is where people get fooled. They think I just need new glasses. Maybe you do. But if vision changes come and go, especially with thirst, fatigue, cravings, or frequent urination, blood sugar should be part of the conversation. Long-term high blood sugar can damage small blood vessels in the eyes, which is why diabetes care includes regular eye exams. But even before a serious eye problem is diagnosed, fluctuating sugar can make vision feel unstable. So do not panic over one blurry afternoon. But do not ignore repeated blurry episodes either. Get an eye exam. Get your blood sugar checked. Ask about A1C, fasting glucose, and whether additional testing is needed. Your eyes may be giving you a window into your metabolism. The sixth early sign is slow healing, more infections or irritated gums and skin. This is one of the most overlooked signs because people separate it into different boxes. A small cut takes longer to heal, a blister lingers, gums bleed more easily, skin infections return, yeast infections become more frequent, toenail fungus worsens, a scratch that used to disappear in a few days now stays irritated. Most people blame age, dry skin, bad luck, or hygiene. Sometimes those are involved. But blood sugar can influence healing and immune function. When glucose stays higher than it should, it can affect white blood cell function, circulation, inflammation, and tissue repair. That can make infections more likely and healing slower. Mayo Clinic lists slow healing sores and frequent infections as possible symptoms of type 2 diabetes. This is where people get fooled. They wait for one huge symptom, but the body may speak in small patterns: gums that stay inflamed, skin that heals slowly, small infections that keep coming back, or feet that need more attention than before. If you have diabetes or prediabetes risk, your feet deserve special attention. Reduced sensation, circulation changes, and slow healing can turn small foot problems into bigger ones. You do not need to be afraid of your feet, you need to check them. Look at your skin, toes, nails, heels, and between the toes. If you see wounds, redness, swelling, drainage, warmth, or a sore that is not healing, get it checked early. Most people think early action is overreacting. With blood sugar and healing, early action is protection. The seventh early sign is tingling, burning, or numbness in the feet or hands. This is a sign many people explain away for too long. A little tingling in the toes, burning feet at night, a strange numb patch, pins and needles in the soles, fingers that feel less sensitive, a feeling like your socks are bunched up when they are not. These sensations can have many causes: nerve compression, back problems, low vitamin B12, thyroid disease, kidney issues, alcohol use, medications, and circulation problems can all play a role. But blood sugar problems are one of the important causes to consider. High blood sugar over time can injure nerves, especially the long nerves that reach the feet. That is why symptoms often start in the toes or soles first. Type 2 diabetes can exist for years before diagnosis, so nerve changes may begin before a person realizes blood sugar has been a problem. This is where people get fooled. They wait until numbness is severe, but nerves are easier to protect before the damage is advanced. If tingling or burning appears with belly weight, cravings, fatigue after meals, increased thirst, frequent urination, or borderline lab results, do not dismiss it as just aging. Ask for testing. Ask what your A1C is. Ask what your fasting glucose is. Ask whether B12 should be checked, especially if you take metformin or long-term acid-reducing medication. Ask whether your thyroid and kidney function are normal. The goal is not to assume diabetes. The goal is to find the real cause while there is still time to protect the nerves. Now there is one important truth that ties all 7 signs together. Prediabetes often has no obvious symptoms. That means you cannot rely only on how you feel. The CDC says more than 2 in 5 American adults have prediabetes, and prediabetes raises the risk for type 2 diabetes and other health problems. Lifestyle changes can reduce the risk of developing type 2 diabetes. This is why testing matters. You may feel mostly fine and still have rising A1C. You may have normal fasting glucose, but high post-meal spikes. You may have insulin resistance long before your blood sugar crosses the official diabetes line. You may be compensating for years without realizing it. So what should you do if these signs sound familiar? First, do not panic. These are clues, not a diagnosis. Second, stop blaming yourself. Sugar problems are not simply about willpower. They are about hormones, muscle, liver function, sleep, stress, genetics, medications, food environment, and daily habits. Personal choices matter, but shame does not heal metabolism. Third, get your numbers checked. Ask your clinician about A1C, fasting glucose, cholesterol and triglycerides, blood pressure, kidney function, and whether an oral glucose tolerance test makes sense if your symptoms and labs do not match. If you have a family history of diabetes, belly weight, high blood pressure, fatty liver, sleep apnea, or a history of gestational diabetes, testing becomes even more important. Fourth, use your muscles as medicine. Muscle is one of the best tools your body has for handling glucose. Walking after meals helps. Strength training helps. Even simple resistance exercises at home can help the body store and use sugar better. You do not need extreme workouts. You need consistency. Fifth, build meals that slow sugar down. Protein first, fiber at every meal, vegetables often, Fewer sweet drinks, fewer refined starches eaten alone, more whole foods, less grazing on cookies, crackers, cereal, chips, and sweet coffee drinks. And if you eat carbohydrates, pair them with protein and fiber so your body does not have to handle a sugar rush by itself. Sixth, protect sleep. Poor sleep can worsen insulin resistance, hunger, cravings, belly fat, and blood pressure. If you snore loudly, wake up tired, have morning headaches, or wake up with dry mouth, ask whether sleep apnea could be involved. Many people try to fix blood sugar with diet, while ignoring the sleep problem that keeps pushing insulin resistance higher. Seventh, stop waiting for diabetes to begin caring. That is the real message. Your body may show early signs long before the diagnosis arrives. Post-meal sleepiness, cravings, growing belly fat, thirst and nighttime urination, blurry vision, slow healing and infections, tingling or burning in the feet. None of these signs alone proves your body is failing, but together they may be telling you that your sugar system is working harder than it should. And this is where you still have power. You can walk after meals, you can protect muscle, you can improve sleep. You can reduce sweet drinks, you can build steadier meals, you can check your numbers. You can talk to your clinician early instead of waiting for a scary lab result. Because diabetes usually does not appear out of nowhere. It often begins quietly, while the body is still trying to protect you. So listen before the whisper becomes a warning. Your energy, your cravings, your belly, your vision, your skin, your nerves, and your sleep may all be telling the same story. Your body is not asking you to be perfect. It is asking you to pay attention before sugar starts making the decisions for you.